how he or she thinks in adolescence. Emotional stimuli, as we just saw, the limbic system, which is more developed here, social stimuli in form of peers, and novelty-seeking behavior. It is a broad concept which includes impulsivity and exploratory behavior. I'll be talking about these in following slides. These all determine how a person decides during adolescence, hence it may lead to positive consequences and it may lead to negative consequences being health risk behaviors and substance use problem being one of the health high risk behaviors during adolescence. So if we see in this small study done by Gardner and Steinberg in 2004, then this study, what it showed was when the participants were doing certain tasks alone and when they were doing with friends, then they really had, it was a computer game, it was called chicken game, and they had to save the chicken from the cars and see the traffic signal in the game, right, which would change from red to yellow to green. So the number of crashes increased when they were when he or she was with friends. So this has a small implication. It gives us impression that decision taking, it differs with peer circle and with friends. And when we talk about impulsivity, it is a predisposition where a person takes reaction, where a person reacts to internal or external any stimulus in the environment without thinking about the consequence. So impulsivity is one of a normative trait of adolescent, and that is because what we just studied, because the prefrontal cortex is less matured in adolescent compared to adults. So delay discounting is a core feature of impulsivity, which states that adolescents really can't wait for rewards. They would rather go for immediate small rewards than wait for big and delayed rewards. And this delay discounting, it starts right from childhood. And this delay discounting has been correlated to substance use disorder and the treatment outcome compared to the adults too. So if we see in this graph, then we just learned about how neurobiologically adolescent brain is different from adults, how impulsivity, peers and emotions, they really matter in adolescent because of the growing and superior limbic system. And this is another graph which shows that both logical reasoning and psychosocial maturity are important for decision making. And it has been said that by 15 years, through various researches, by 15 years, adolescent has logical reasoning power comparable to adult. But then, if a person has already developed such logical reasoning power, why would he take so much risk? So there is another explanation to it, that psychosocial maturity is delayed in adolescent. That's why, even though the logical reasoning is comparable to adults, still the adolescent, they don't think, they don't decide, and they tend to take risk more as compared to adults. And talking about various changes in adolescent, we cannot forget about the various hormonal changes, and this too has implication in the substance use problem, because we all know that there is developing secondary sexual characteristics, sex hormones, and this directly, it affects the reward pathway, the same pathway which we just saw and is related to substance use disorder. So because of the increased sex hormones, the increased receptors in certain brains related to the reward pathway, hence adolescents are more motivated towards sexual stimuli. They are more aggressive because their limbic system is matured more compared to the decision-making prefrontal cortex, and there is more risk of substance use. So having gone through a complex information about the adolescent normal brain, now if we see if taking substance, does it affect the neurobiology? Does it just affect the psychosocial aspect, or that it is also important because the the brain changes and how it works changes? Then I have just done a brief review focusing on alcohol, because there is quite a big data on alcohol. For tobacco, we have very less data and mostly limited to animal models, so I have not included those. And I've also tried to include cannabis, these three being very common in Nepal. So if we just, this is a small review, there are multiple studies. The studies done comparing normal versus adolescent using alcohol. They show that the hippocampus, the part of the brain which is implicated in memory and learning, that decreases in size. That is less, smaller than compared to the to those who don't take any alcohol. Similarly, if we see the prefrontal cortex, which we are repeatedly saying, which is implicated in cognitive control and which helps in decision making, taking substance, the prefrontal cortex size has also been found to be decreased in various studies, and there are some studies which show that it is more decreased in females than compared to males.
More about if you're doing like awareness programs and stuff. I work at a high school, so I'm very interested to know if you do anything with schools or like have you created any awareness programs, anything like that in terms of the prevention aspect of it.
So you really want to know my experience? We did a survey to know what is the prevalence, because we really don't have good data about the issues in college-going students. And then we had a preventive session where we provided awareness about the various psychological problems and how they can approach and then deal right on the first hand. So yes, I have started to work in it, but then I'm just, I guess, in the beginning phase.
Attempt. I think the question of prevention is helped by understanding the areas of the brain you're talking about are social areas. They're the social brain, and the prevention, as you showed beautifully, that the particular prefrontal cortex is overconnected and develops through social risk taking. And if you can aid prevention and groups of young people not taking up behaviours together, that is going to be much more successful. There will still be individuals, but the social brain is best prevented from these behaviours in social activities. So I'd really encourage you to keep going with those social developments.
Thank you, Dr. Thank you.
Really hurting because they had like people in their family with alcoholism, and I suddenly realized there's so much resource, the way they're like managing everyday day-to-day life, and then I could pass that on to other families that were also struggling. So I was wondering if you had thought about that, because I'm also thinking of teenagers. If there is alcoholism in the family, how it doesn't get talked about? Like in my family too, there is. And I think alcohol affects different people differently. Like, I mean, for me, if I'm stressed out, I drink, I get more depressed, because it's a depressant, And so
well, taking family, again, as we just discussed, taking family members into any sort of treatment is really important, because adolescents can't really complete their treatment without the support of family members, because they are in a stage of being dependent to growing independent, hence we should combine family members. So I was just sharing my experience in working in a college where I could not involve family members in the first setting, but then in general, OPD or any treatment service, treating adolescents single-handed is not the right way of treatment. We should definitely take family members into the treatment, and that is how the sustenance is possible. Otherwise, we can't really continue the treatment and they will just go away. So yes, as you rightly said, we should bring family members. And now the most challenging part when any adolescent would come alone in the OPD is to make him realize the importance of mental health issues, how family plays an important role, and why we are trying to meet his or her family members. Because sometimes if we can't educate the adolescent in this way, then he or she might just get offended because he has come to get treatment, and then we are calling the family members. So yes, educating the
Nantu is currently working in child and adolescent psychiatry OPD in Kanti Hospital in Kathmandu. He graduated from Kathmandu University and did a postdoctoral fellowship in child and adolescent psychiatry in NIMHANS in Bangalore in
Thanks for the introduction. This presentation is actually based on my postdoctoral fellowship dissertation while I was training in NIMHANS, India. And so we were basically talking about resource mapping and needs assessment for child and adolescent mental health services in Nepal. I have purposefully left out the literature review of the studies in Nepal because those data which were available were conducted in, the studies were conducted in small samples, specific geographical areas, so could not be generalized to the whole population in Nepal. So I'd like to talk about a short background. Nepal has recently struggled out of a decade-long armed conflict with over 16,000 deaths and millions displaced. Greater mental health need for the population. Nepal is one of the low and medium income countries and has its struggles with fulfillment of basic needs of the population. One of the important needs of the population is general health and mental health in particular. And the mental health needs of the population and the services received have a significant gap. Till date, Nepal does not have a mental health act, and mental illness is included under the Disability Act. And the National Mental Health Policy was formulated earlier in 1996 and then revised in 2017, but in either of the instances, it has not been properly implemented. Till date, there has not been any nationwide epidemiological study on the status of mental health of the population, and the studies that have been done are mainly focused on adults and those who are limited to specific geographical areas. Almost 50% of the population of Nepal are children and adolescents, as is for other LMICs, and even the studies on children and adolescents in Nepal is very scarce. And the studies that have been, some studies have been done following armed conflict and earthquake. However, a nationwide statistics is still lacking. However, we also recently had some presentations regarding a new epidemiological study that is being done in Nepal, which is a very good news for all of us. And there's also poor documentation and reporting of mental illness and related events in the population. The national health policies that are related to children and adolescents in Nepal are limited so far to immunization, nutrition, community-based integrated management of neonatal and childhood illnesses, and maternal health, also adolescent sexual and reproductive health respectively. However, there is no national policy and plan related to mental health of children and adolescents in Nepal. So the rationale for the desk review. So we did this desk review in order to understand the various factors which either directly or indirectly affect child and adolescent mental health in Nepal. And to study the current health service systems in the country so that we could find possibilities to kind of incorporate child and adolescent mental health services in the already available resources that we have. And to review the studies in Nepal related to CAMH with an attempt to form a comprehensive database of all the studies that have happened till date. And also to review the available governmental as well as non-governmental bodies which are providing services to children and adolescents, and to inquire upon whether mental health approaches have been used during those services. We also targeted to produce somewhat of a status report on the area of child and adolescent mental health in Nepal, and this will also possibly provide a base for further studies to be done in this particular field in the future.
Thank you for compiling all the data, and it was really wonderful that we placed it at the last. This itself looks like a conclusion of the child and adolescent mental health in Nepal scenario.
Thank you, Dr. Morgan. You have outlined various steps and activities that needs to be adopted and implemented. The question is, who is going to bear the cat?
Yes.
Can you answer that? who is going to monitor, or who is going to multi-sectorial and holistic approach, and how it will be possible in Nepal.
I don't think that any particular person or an organization will be able to do it. So like Sir said, who is going to bell the cat? I think everybody has to hold the cat together and then put the bell on the cat. And as we can see, even in this conference, we have presence from multiple, from delegates, presence of the delegates from multiple nations, and we are getting together and discussing all these important topics. So I think the first step towards promotion of child mental health is to talk about it, and then comes the ideas about how to go about doing it further. There have been some work which are going on. Earlier, Sir had also, Arun Sir also, I think, mentioned that a UNICEF project has come in, which is a pilot, but then this is precisely what we are trying to do with that particular project. We will be training some number of doctors and paraprofessionals who will be working basically in the primary healthcare levels and zonal or district hospitals. So by doing so, we are trying to sensitize them in terms of mental health services, because we can't just expect that everybody who has mental health issues in Nepal will come to a tertiary center, so we need to get the services to where they are. So that's what is being targeted for now. I think in the next 6 months we will have completed it and have some idea about how effective it has been, how feasible it is, so that maybe we can expand further. So I think
this is just my opinion, because I must look on this adolescent nutrition issues, and we have a lot of discussion inside the offices. There are the issues around the adolescent, like reproductive health, and now this is new issues like mental health. So whenever we go collective in the government system, so for this element, the government is a little bit resistive to take one agenda at one time. So the concept is, because we are in federal structures now, the palikas are there, they have the power to decide at the local level as well. So sometimes we forget this palikas as well when we plan, so somewhere it is missing. And why don't think common center of excellence at palika level, where all services, adolescent nutrition, mental health, reproductive health, and all this can be integrated in one package, and that will provide the services to the children and adolescents. That is just my suggestion. Thank you.
Also, and yes, there are many challenges, and if you look at them, it seems endless and it seems hopeless. But I can tell you, I know the mental health scene in Nepal since 2002, and to hear speeches, presentations like this, and to have a conference like this, there are many reasons also for hope, for an improvement. And I want to say thank you all very much for this.
thank you very much.
Thank you, Chairperson, for conducting the session. I think there is a notice from the organizer's side.
The ceremony will be graced by the presence of Honorable Minister of Health from Minister of Health and Population. So, and he is highly enthusiastic to join us. He has already flown from Biratnagar Airport and will be joining us straight from Kathmandu Airport to this ceremony. So making a little adjustment, we would like to request you to join us for lunch, and we reconvene here in this hall for the closing ceremony. This is a Once again, I stand in front of you to happily and proudly convene the closing ceremony of the first International Conference on Child and Adolescent Mental Health, Nepal 2018. We will start this closing ceremony with seating at the dais. I would like to request the Conference Organizing Committee Chair, Epidemiology and Disease Control Division, Director Dr. Vivek Kumar Lal, to please get his seat at the dais as the chair of this closing ceremony. We have the pleasure of welcoming Honorable Minister of State Ministry of Health and Population, Dr. Surendra Kumar Yadav, to this ceremony. I would like to request Dr. Surendra Kumar Yadav to honor the ceremony as the chief guest of the closing session. Surendra Raman Singh to kindly take the seat in the dais as the special guest of the ceremony. Finally, I now invite Dr. Arun Rajkumar to be seated at the dais as the co-chair of the organizing committee. We would like to welcome our guests with khada and bouquet. I'd like to request Surajai to By getting feedback from a participant, I invite Ms. Karuna Kumar. She's a psychologist by profession and has presented a paper as a poster presentation in this conference. We'd like to hear from her about her observations regarding the conference.
And namaste. It's an honor and privilege to be a part of this forum where experts and professionals share their knowledge, experiences, practices and learnings. The plenary and all the parallel sessions were equally important and relevant. Some parallel sessions topics were so interesting that I had difficulty to opt one of them out. In this one of the very few international conferences focusing on child and adolescents' mental health issues, the topics presented and discussed were all very insightful and helpful in providing different perspectives in terms of situation and needs in the context of Nepal, in the region and internationally. I personally felt that promotion of mental health of child and adolescents is very much needed and possible by coordination with Ministry of Education as well. Thank you so much.
Thank you, ma'am. The co-chair of the conference.
Chair of the session, Dr. Vivek Kumar, sir. Chief guest, Honorable Minister of State, Dr. Surendra Kumar Yadav, Dr. Dipendra, sir, and all our invited guests, seniors, colleagues, and friends. We all together had 33 presentations. We had 16 international delegates and 17 national delegates. I think this is the first time we heard from the national as well as the international delegates that some of the research and the work that has been presented are truly of international nature. So that makes me really happy and proud for all of you to take part in this seminar. The seminar highlighted on the importance of child and adolescent mental health issues, why it is a national emergency. Any given time, with the present data, we are talking about 13 to 17% of the children, looking at the Nepali data, suffering from some kind of emotional behavioral problems. So if you count that in numbers, that is anywhere between 10 lakh to 13 lakh bacha who need some kind of help in any given time. And this is a national emergency if you really think about it. These are the children who will grow up tomorrow and build the nation. So I'm really happy and thankful to the ministry for organizing this seminar. Special thanks goes to our ECDC director, Vivek Kumar Lal sir, who took it on his heart as soon as he got posted and we walked in front of his door. He said, we will do this seminar, and making this a grand success. Now, I'm going to reiterate one last point, that is, child mental health is neglected, and from the government perspective, this is a big step. But in future, any program we envision in a ministry of mental health, please include children. Children under the age of 18 amount to 42% of the population. When you are allocating any program, any budget, please allocate at least 40% of programs and budget to the child and adolescent mental health. This is must, and I'm so happy. Our minister turned his head and looked at me and nodded and said, yes, we'll look into it. Now we'll get the declaration of this conference. Dr. Neena Rai, organizing secretary of this seminar, will read the declaration.
Thank you, sir. So the declaration for 2018 from this conference is, it is promoting preventive and curative rehabilitation and research activities in the field of mental health should be carried out through all the levels of healthcare delivery system. Mental health for children and adolescents has to be prioritized with adequate resource and funding. Dedicated budget in proportion to population should be allocated by Ministry of Health and Population to their needs. The right of the people with mental health problems should be upheld at all the times through the relevant policy and legislation compatible with new federal system of the country. So recommendations are, number one, mental health condition of children as well as caregivers need to be addressed. Number two, children with specific needs, for example, neurodevelopmental problems, disabled child, those in difficult life circumstances and those in vulnerable groups need special attention. Number three, substance use disorders in adolescents need special attention, should be considered as the mental health problems and require multidisciplinary approach. Fourth, emerging issues like internet addiction, cyberbullying require further exploration, research and intervention as well. And fifth one is timely intervention for addressing mental health issues should be prioritized to reduce deaths due to suicide. Different models of training and service delivery currently in use by various sectors and agencies should be standardized to ensure uniformity and quality in them. 7. Integration of clinical services in primary healthcare level with community-based approach for prevention, treatment and rehabilitation of mental health conditions should be ensured at the earliest. 8. School mental health programs should be developed and implemented in order to increase the awareness, prevention and treatment of mental health problems of the children and adolescents. 9. Capacity of existing healthcare delivery system, including human resource, to fill the treatment gap of the children and adolescent mental health problems should be adequately developed and enhanced at all levels. And 10. Nationwide epidemiological studies on mental health, including children and adolescents, should be promoted. And the 11th and the last one is collaboration between the state and other agencies for generating evidence-based strategies and interventions should be strengthened. Thank you.
The minister with a frame, big frame, and we'll hang it in your office for the.
of many, many people and organizations and agencies. I now request Dr. Farindra Baral, the Chief of Non-Communicable Disease and Mental Health Section at EDCD, to provide the
respected Chairperson, Dr. Vivek Kumar Lal, Director of EDCD, Chief Guest, Honorable State Minister of Ministry of Health and Population, Dr. Surendra Kumar Yadav, distinguished guest, Dr. Dipendra Raman Singh, Director of Quality Regulation and Standard Division of Ministry of Health, distinguished guest and co-chair Dr. Arun Kumar, Child Psychiatrist of Kanti General Hospital, all the national and international participants and delegates, ladies and gentlemen. It's my privilege to propose a vote of thanks on this two-day international conference on child and adolescent mental health. I, on behalf of EDCD and the entire fraternity of the institution, first of all, extend my most sincere thanks to Mr. Mahendra Prasad Shrestha, who took the lead role of the chief guest during the inauguration ceremony. I also would like to express my heartfelt gratitude to Dr. Arun Kumar, who is the solo child psychiatrist of Nepal, for his sensational speech on child and adolescent mental health service in Nepal. I am also grateful towards Dr. Meghnath Dhimal for NHRC for his finding of National Mental Health Survey. I am also obliged to the country representative of UNICEF, who has delivered a speech in the inauguration of this conference. I also feel indebted towards the national and international presenters who presented their findings in these couple of days. I also appreciate the effort of the session chairperson and co-chairperson who conducted the session with remarkable ease. I am also thankful to representatives from other line ministries, National Women Rights Commission, National Women Commission, NHRC for their valuable presence. I am also thankful to the organizing committee led by Dr. Vivek Kumar Lal, who toiled days and nights to make this conference a grand success. My heartfelt thanks also goes to the scientific subcommittee member led by Dr. Ravi Sakya from Patan Academy of Health Sciences, who scheduled the program to perfection. I am also obliged towards Mr. Ramlal Shrestha and his team who worked for the financial distribution of the completion of this conference. I would also take this opportunity to thank UNICEF for providing the major funds to make this conference a great success. I am also indebted towards the Hospitality and Logistics Subcommittee under Ms. Srishti Lamithane, who gave the churches and also served as a master of ceremony for the 2 days conference. Last but not the least, I am under the obligation, Honorable State Minister of the Ministry of Health and Population, Dr. Surendra Kumar Yadav, for his presence in this closing ceremony. The media personnel and journalists are also thankful for their tireless strive to publicize this conference by different media. I would also like to thank all the delegates who showed their interest to participate in this conference. I also would like to thank every individual who supported this conference directly or indirectly.
Division to give his remarks.
Thank you very much. Chair and co-chair of this conference, Honorable Chief Guest, Minister of the State, Minister of Health and Population, Dr. Surendra Yadav, distinguished guests, all the dignitaries were present here. First of all, I would like to congratulate the organizing committee for the successful conference, and at the same time, I would like to thank all the international and national delegates and participants of this conference for your presence, fruitful interaction, and meaningful sharing and deliberations. It highlighted the word and spirit of slogan of World Mental Health Day of the year 2018, Youth and Mental Health in Changing World. It will definitely help us, especially Government of Nepal, national and international agencies, health professionals, social workers, academics, and research institutions come together for the promotive, preventive, curative, rehabilitative, and research activities in the field of child and adolescent mental health in Nepal. The declaration just made of this conference will provide the right path to promote the mental health and psychosocial well-being of the children and adolescents, the future of this country. At this moment, I believe all of you have become the part and parcel of the mission of Government of Nepal to deliver the comprehensive health services, including mental health services, to all the Nepalese people, including children and adolescents, as their fundamental right. On behalf of Ministry of Health and Population, I would like to express my commitment that mental health, including child and adolescent mental health, will be a prioritized issue in the Ministry of Health and Population in days to come. Once again, acknowledging the effort you have made, I would like to thank Organizing Committee for organizing such an important international event, and also thank all of you for your valuable presence in this conference. Thank you, thank you.
Thank you very much, sir. Finally, the moment that we all have waited for is here. We will now hear words of wisdom and encouragement from our chief guest, Honorable Minister of State, Ministry of Health and Population, Dr. Surendra Kumar Yadav. I request Honorable Minister of State to address the conference.
Chairman and co-chairman of Conference of Organizing Committee and representative from Ministry of Health and Population, Dr. Dipendra Raman, distinguished delegates from different parts of the world, and from the Nepal, representative of international and national organization working in the field of the mental health, and all the participants of this conference. I want to say to everyone, warm welcome and good afternoon. It is my pleasure to be here in the first international conference on the child and adolescent mental health in Nepal. I'd like to congratulate all the members of organizing committee for the taking initiation and organizing such important events in the child and adolescent mental health. The journey of mental health service in Nepal started with the opening of the mental OPD in the Bir Hospital and expanded gradually in the government and private sector. Almaty Declaration in 1978 guided us to integrate the mental health service in the primary health care system. Nepal began by the endorsement of the National Mental Health Policy in 1997. We have highlighted mental health as an important component of public health in our constitution. National Health Policy, Multi-Sectorial Action Plan for the control and prevention of non-communicable disease, Disability Protection Act and Public Health Act. Mental health is an essential component of non-communicable disease, and the government of Nepal, Ministry of Health and Population has adopted mental health agenda as one of the top priority. In the federal context, the government of Nepal is reconstructing health system to provide cost-effective and quality health service for all Nepalese. Government of Nepal has established the non-communicable disease and mental health sector under the Epidemiology and the Disease Control Division within the Department of the Health Services to act as the focal unit to coordinate all the activities related to mental health and also to help Ministry of Health and Population to formulate policy, strategy and the action plan for this sector. We are working to incorporate mental health service into the existing healthcare delivery system in the form of the basic healthcare package. We have included other mental health conditions to cover by health insurance policy. In line with the other health services, mental health services also encompasses promotive, preventive, curative, rehabilitative and palliative services. While working on the reconstructing of the health services, we are taking consideration of all above mentioned components. It is our duty to collect responsibility to reduce stigma associated with mental illness and raise awareness to seek mental health services in the community level. It is necessary to increase our capacity to address mental health needs and provide quality mental health services in all levels, federal, province, as well as local. We have to address the need of the more than 25% of population suffering from the one or other kind of mental health problem. The government of Nepal will make additional efforts to integrate mental health services into the existing healthcare delivery system. We will give attention to upgrade existing hospitals to provide sub-specialized, including child and adolescent mental health services in federal and province level. As we know, medical science in ever-changing field, and we need to ensure the availability of latest standards and best practices in the field of mental health services. The government of Nepal will take action to increase budget for awareness raising, human resource development, services availability, and all our mental health services management. I asked the EDCD to initiate the activity to address the existing mental health gaps. The Ministry of Health and Population is committed to allocate the budget to meet the mental health need as an important public health issue. Once again, I like to thank you all for your wonderful and interactive participation and successful organizing of this international conference in Nepal. So, thanks all.
Thank you very much, sir. Lal, Chair of the Conference Organizing Committee, Director of Epidemiology and Disease Control Division, to present his closing remarks and also formally conclude the event. With this, I personally...
Good afternoon, ladies and gentlemen. Respected Chief Guest, the Honorable Minister of State, Ministry of Health and Population, Dr. Prefrontal Kumar Yadav, our distinguished guest, Dr. Dipendra Singh from Ministry of Health and Population, the co-chair of Conference Organizing Committee, Dr. Aruraj Kumar, officials from Ministry of Health and Population, different line ministries, different councils, commissions, and professional bodies, experts in the field of psychiatry and psychology from various academic institutes, hospitals, representatives from international and national organizations which are working in the field of mental health, media personnel, my colleagues from the Conference Organizing Committee, ladies and gentlemen. As the chair of the session and also the last speaker, I have an easy job. I was looking at my list of things to do and I see that almost everything has already been taken care of. So I see that all the technical content has been delivered. A very clear and resolute political commitment on behalf of the Ministry of Health and Population has been expressed by the Honorable Minister of State and Dr. Dipendra Singh. The declaration of the conference has also been read out and adopted and accepted, and a vote of thanks has also been given. So I was looking what I should do. So in the end, it's a matter of pride for me as the Director of Epidemiology and Disease Control Division that we've been able to, with everybody's support and active participation, hold the first ever conference on child and adolescent mental health. And I'm grateful to everybody for their support in making it a truly successful event. So I'm particularly grateful to our Minister of State. As you know, he was outside of Kathmandu and he drove straight from airport to attend this meeting because he wanted to make it to a meeting because it shows the commitment of Ministry and Minister personally to this agenda. And he, being himself a doctor, understands things much better than I need to explain. So it's a very important event and very, I would say, privileged for us that he could make it to it. And I'm also thankful to all the distinguished guests who sat through all this. And I'm also thankful to particularly all the experts and guests, delegates who are the person who made this conference truly successful by sharing their knowledge, their experiences, and I'm very encouraged by all your inputs, by the feedbacks that I've received from you, and we'll try as a team again to try to hold this kind of international conferences, particularly in mental health, on a regular basis as far as possible, again with all of your support. And for all of those guests who have come from abroad, you might have noticed it is the best weather or perfect weather to explore Nepal. I hope you get some time to do that. And wish all our guests a very pleasant stay and also safe travels back to their destinations. And before I end, we have a token of love for our special guest.
To the special guest here, Dr. Dipendra Singh.
Thank you, everyone. And with that, I would like to inform you that this conference comes to a formal closure. Namaste, thank you, everyone.
To project your